Hello, everyone, and how are you doing this first full week of July? It's hard to believe we are halfway officially through this year, especially with all the other things that have been going on. You are currently with the Center for African American Health and one of our amazingly, astonishingly wonderful Facebook Lives. So we'll wait just a few more minutes for people to tune in, and then we'll get started. All right then. People will probably be starting and to come in as we are going through the midst of our questions, but we don't want to keep those of you who arrived on time waiting much longer. So today I would again like to say this is your welcome to the Center for African American Health Facebook Live Lunch and Learn series. And I am Yolanda Gotier, and I am the Senior Living Health and Wellness Navigator. Basically, all that really means is if it has anything to do with people over 50 and far-reaching in age, that's me. I am your go-to person. But if you're unfamiliar with the Center for African American Health, we've been in the community for more than 20 years with a focus and commitment to improving the health and well-being of the African American community. We are community-based, evidence-based, disease prevention and disease management programs, events, and services. You definitely can learn more about our work and our programs by visiting the website at caahealth.org, and that is also displayed in our resources. Now today we are discussing the important role of caregivers and providing tips and resources necessary for them to maintain their physical and mental well-being. Joining me is Nadine Roberts Cornish, founder of the Caregivers Guardian, an organization that is dedicated to empowering and inspiring caregivers to create a process that will allow them to tend to their loved ones while honoring their own needs. Because as we know, you can't pour from an empty cup. Nadine has extensive knowledge and background in public health education and consultation, as well as personal experience navigating the journey as a caregiver to her own mother for 15 years. Her 2016 publication, Tears in My Gumbo, The Caregiver's Recipe for Resilience, is deemed the secret sauce to caregiving, and we all know how important secret sauce is. She also recently released a follow-up book, Prayers Guardian website, tcgcares.com. We'll also provide you with this link in our chat. As we move through today's session, please feel free to type your questions in the chat box, and we will address them if time permits. So Nadine, I just want you to know that this topic could not have come at a better time, as I am now charged with being my mother's caregiver. And there are some days when I am really good about it, and some days where I just feel like a Grinch, a grinchy. And she's dementia, and so sometimes the questions, the constant question that she'll ask, it's sort of like, there's a part of me that says, did you just choose one question for the day that you just gonna ask me all day long? And then it's like, how many times can I just be open and understand what's going on with her to be able to answer her? You know, Mom, this is the 25th time you've asked me that question. My answer is still the same. So, you know, I am so glad that we are having this topic. So I want to welcome you and thank you for joining us
Yolanda,
today.
Thank you so much for having me.
Yes.
And I want to say welcome to the club. I always say there are only 4 kinds of people in the world. There are those who will be a caregiver and those who are going to need a caregiver. So for everybody who's listening, whether they are actively caregiving or not, you will be part of this club. We're glad to be here to have this discussion for sure.
All right, so maybe we should start printing membership cards.
Absolutely, let's do it.
So we do have a couple of questions, and I just want to start right in. And those are about concerns with being a caregiver during this COVID-19 pandemic. And so how would you say the role of caregivers has changed given the current obstacles that we face? such as telemedicine, quarantining, allowing people in our homes? How have they changed?
So just as COVID-19 has impacted the world, it has impacted more the caregiver, right? And so that change has happened in a number of ways. Caregivers are often isolated, and this COVID-19 environment, they are even more isolated. I think one of the things that's happened is that people who weren't cognizant of the caregiver role are now more aware of what that isolation feels like, what it feels like to not have anybody dropping by, what it feels like to feel that you've been neglected because people are so busy doing whatever it is that they're doing. And particularly in this time of quarantine, kind of experience what that feels like. And you take that experience, and I invite them to magnify that tenfold, and then you have an idea of what the caregiver goes through on a day in and day out basis, particularly the caregiver that's caring for a loved one in a home. So extra precaution, extra caution, wash your hands constantly, wear the mask, that's important. And if you are sick or feeling sick and you're caring for someone, you have the responsibility of caring for someone, then you are around being extra careful and being sort of the guard for the person that you're caring for.
Okay, thank you for that. Now, sometimes we're put in a position where not only are we caregiving for a senior and elder in our home, but we also have small children or just children in our home.
Absolutely.
And so there's that sort of push-pull tug that happens, not wanting to treat the elder as a child and not wanting to parentify your children because you're providing care for this adult person. So with that, in the midst of this pandemic, how can we offer tips on managing that household when you have this duality going on?
I call that, Yolanda, a harmonizing act, not a balancing act, because I don't believe there's such a thing as balance. It's harmony that you're seeking. And the realization that you're in a multi-generational household and that you have younger children, teenagers, etc. We're all in this together for real in that environment. And so having specific roles and having the conversation first and foremost, right? So that everybody's on the same page and that we're working together as a team, that the kids are as actively involved in the caregiving process. And that means, when I say they're actively involved, that means they have the responsibility of sitting down with grandma, grandpa, whoever the loved one is, and reading to them, engaging in conversation with them, and being an active part of the process. Mm-hmm. So they are a valued member of the team. They are recognized as a valued member of the team. And they're typically very receptive to that, because in most instances, that's really a loving situation. Grandma, grandpa, that elderly loved one is usually the one who spoils the kids more often than not. So kids are really drawn to that. But too often we separate and we decide that they shouldn't have any responsibility, or we're going to shield them from the reality of what's going on, when it really is beneficial to the entire family unit to have them engaged and actively involved in the caring process. It's also important to make sure that you are setting time specifically aside, especially in this age of everybody being at home. Have that special quality time that you're spending with each of your children. And even if it's only 15 minutes that you're carving out, that's that dedicated 15 minutes that is specific for that particular child. And if you've got a schedule and they know and they can expect that, that's something they look forward to. And it really minimizes the tension and the resentment that can build because they're not getting their just due. But if they've got that specific time where they know they're going to spend with mom, with dad, then they can look forward to that, and that can really be a unifying factor for so many families.
Okay. And along with that, I know we've touched on the topic of children, but what happens with your partner if you happen to have one during this? How do you divide those roles?
Date night is for real, y'all. It's real. And it's necessary to schedule it to make sure that it happens. During my caregiving journey, I was a newlywed. And so I was really concerned about the quality of time that I was spending with my husband versus the amount of time that I was spending with my mom. And we both committed we committed to the cause of caring for my mom in the home. And my husband's a firefighter, so he's got that special gene inside of him that makes him extra special. But it also meant that we were often out of balance, which is why I say I don't believe in that. It's really about finding the harmony in the situation. And what we were able to do was really schedule time on the calendar to ensure that, twice a week we had our date night. We left, and we had a rule. We didn't talk about mama. We didn't talk about what was going on with our caregiving role. We were really just committed to talking about each other and just having fun, And so that's necessary, that you actually schedule the time.
Okay, thank you for that. So we know that sometimes with caregiving, our the people that we are providing the care for need outside assistance by way of physical therapist, someone who comes in to bring in new tanks of oxygen, an occupational therapist, maybe even the social worker that comes in and provides some mental health time. So how are we able to ensure, if that's possible, that those coming into our house, into our homes, are safe? Should we be checking their temperatures?
And that's a real serious issue for so many who are homebound, right? And in this time of COVID, those precautions are absolutely necessary. And so if someone shows up at your door and they're not wearing a mask, even if they are a healthcare provider, that lets you know that that's a person that's not welcome into your home. It's just that simple, just that cut and dry. If they're not exercising the precautions, the mandated CDC precautions, as they come to your door, then it's a no-brainer. It's absolutely a deal breaker. People who come to your home must be as conscientious as you are about caring for themselves first and foremost, right? Because this really is about protecting ourselves so that we can protect those around us. And so wearing the mask is essential. That person checks and has worn the mask, great, come on in. You're feeling good today, right? That's always the question everybody's asking now. No fever, no cough, no chills, right? You haven't been around anybody? Okay, you can come in. And then the first thing that they should do is wash their hands. Even if they're wearing gloves, they should take off the gloves that they have had on, wash their hands, and put on new gloves, right? And then if this is a first time encounter with someone that you don't know, ideally over the phone, you're having a discussion about the precautions that you take in your home and the precautions that you expect them to take when they arrive at your home as well. Right. And so if this is, you've had this discussion, that person is there and they are, maintaining distance from everybody in the house, because unfortunately with this disease, we just don't know. You can have it and not even know it, right? Even if you had a test last week. So being extra vigilant is just yet another challenge that the caregiver takes on during this process, and just ensuring that those individuals who are coming into the home are every bit as committed to your loved one's well-being as you are. And they exemplified that by just the basic things that they're doing.
Okay. What about in-person medical appointments? How is it that we ensure the privacy and independence of those we are providing care for, while ensuring that we are getting accurate medical information when they're having doctor's appointments? How do we manage that?
So telemedicine is definitely happening for so many people now, and I really encourage those of you who can to take full advantage of that option. But for those of you who are having to do an in-person consultation, your normal visit, again, you're taking the same precautions. You are using your hand sanitizers. You're wearing the mask at all times when you are, especially when you are in that environment. I can say that the hospitals, the medical centers, doctors' offices are definitely taking the extra precautions, and they are making sure that there are typically no more than 1 to 2 people in the waiting room at all times. Some offices are actually telling you to wait in your car until you receive a text message or a phone call. All of these are great precautions to take, because the more you limit your exposure and your loved one's exposure to other people, the better you are in terms of maintaining your health and well-being.
Okay, thank you. So now let's tune in on the caregiver schedule.
Oh, yeah.
We all know there aren't enough hours in the day, even though it feels like COVID-19 has given us at least 30 extra minutes for those of us who are working from home. What advice can you share about the most effective way to manage time and prioritize tasks?
So the biggest thing that I share with the caregiver and invite them to do is to really take a look at their calendar and to ensure that they schedule themselves on their own calendar. Right? We can get so busy. Work is always the priority, and then family and all of our obligations, and then all of our appointments. We can get so busy scheduling everybody else that we forget to schedule ourselves. And so I always invite caregivers to place themselves on their calendar. I introduce many to the color-coded calendar system. My favorite color is red, so when I look at my calendar on a weekly or on a monthly basis, I can look at it at a glance, and I think I can show it. Maybe I can show it to you here? Not sure. There we go. Yes. If you look at my calendar at a glance, you see a lot of red. That's my color. That is me time. That is the time that I have designated for my own self-care. And when I work with caregivers, it's like, if you don't want to use the calendar, fine, but show me how, demonstrate to me in a visual way how you are ensuring that you are the #1 priority in your life. I say all the time that if you are not taking care of yourself and making yourself the priority in the caregiving journey, then you are really doing a disservice to everyone. You have to be first. You must make yourself a priority. And we move from lip service, because it's easy to say it and it's a lot harder to make it happen. And we really implement practical tools to demonstrate actually what does that look like. And the calendar, colored calendar, is just one of those tools.
Okay, so I have one other question about that, and it's, how did you come to the place to be able to honor those boundaries and self-care time?
So fortunately, I had a partner who insisted that I do that. I took care of my mom in the home 24/7 for almost 4 years. When I moved her in, they said they didn't know if she was going to live 3 weeks, 3 months, or 3 years. She was with us almost 4 years. And so my mother required 24/7 care. And I worked, and life was happening and all of those kinds of things. And it just really became necessary that I really make the decision first and foremost. You have to decide that you must be the priority in the situation, because if something happened to me, then my husband would have the responsibility of having to take care of me and my mom, right? And so in any family situation, the dynamics are that if the primary caregiver gets sick, or if something happens to them, then somebody else is going to have to step up to the plate. In some instances, caregivers say, well, if I don't do it, it's not going to get done. There is nobody. There's always somebody. Just like that job you go to, and you feel like, you are indispensable, and, it can't happen without you. Let something happen to you. You will be replaced like that, right? And the same reality is such for caregiving. You will be replaced. So let's not replace you. Let's make sure that you're taking care of you doing all of the things that you need to do for yourself, like making your own doctor's appointments a priority, making your own health care. You know, a lot of times caregivers are making sure their loved ones get these amazing meals, and it's like, have you eaten today? And it's, you know, 4 o'clock in the afternoon. Well, no, I'm going to grab something in a minute. That's not appropriate self-care. And so just making sure that you're eating, exercising, tapping into whatever your spiritual source is so that you are being filled up spiritually is essential in the caregiving journey.
Okay, so we have a question. Are there any tips on how to best use support groups to help caregivers with stress management, and how best to find one?
Okay, so thank you for that question. It's an excellent one, and it's a necessary one. Support groups are essential in the caregiving journey, especially for someone who's dealing with a challenging situation or someone who's been a caregiver for longer than 6 months. A support group is a wealth of information, knowledge, and just camaraderie around what you're going through. Nobody understands the caregiving journey like a caregiver. You'll have well-meaning family members and friends, but if they are not right in the trenches with you, or if they haven't been in the trenches as a caregiver caring for a loved one, then they really don't know what you're going through. But in a support group, they do know what you're going through. And so you can find support groups a myriad of ways. I offer support calls every Monday evening at 5 p.m. For caregivers across the country. It's called Calling All Caregivers, and you simply check in, email info@tcgcares.com to get the Zoom link, and you check in, and we're on for an hour addressing issues and concerns. But there are a myriad of support groups. Alzheimer's Association offers a number of support groups for all types of dementia. Alzheimer's is a form of dementia, the most common form of dementia, and it is absolutely one of the areas where caregivers really need a lot of support.
All right, and let me think. Just what else would you, just waking up in the morning and knowing that your day is going to start early, how would you say you begin or begin each day?
First and foremost, you have to put the phone to the side, leave Facebook alone, leave all of your social media alone, and start the day in prayer, meditation, whatever your spiritual source is for you. Tap into that, because you're going to need that to carry you through the day. I can tell you that there was a distinct difference between my abilities to go through the day with ease and grace versus going through the day with angst and frustration, right? If I didn't tap into my spiritual source first, if I got distracted or was awakened out of my sleep and had to run in to deal with my mom and just got busy and forgot about doing my spiritual work first, then I can assure you that day would ultimately morph into frustration and angst, as opposed to ease and grace. And those days that I did tap into the source, you know, having a plan is also really important. I define a term called conscious caregiving, caring on purpose with intention and a plan. And when you are consciously caregiving, as opposed to kind of caregiving by the seat of your, what is it, the seat of your boots or whatever, it really is, that's caregiving in chaos, right? You're kind of just going with the flow, and whatever happens, happens. And even though that might be a nice attitude to have, having a plan and really thinking out, planning out what your caregiving journey will look like, because life is going to happen. And the unexpected is going to happen, and having your affairs in order, that necessary paperwork. I know that Michelle Adams was a guest a while back on the show, and she talks about how essential it is to have all of your necessary legal paperwork in order. So that's definitely one of the important tips on how to manage and how to maintain your own sanity during the caregiving journey.
Okay, in our last 5 minutes, we have one other question, and it is, given the limitations of COVID-19, how do we deal with an elder that you're caring for who wants to always go out to the store or other places that might not be safe?
So I would say to identify places that are more safe. Here in Denver and all around the country, you've got botanical gardens, right? We have outdoor environments where masks are required, social distancing is required. And so your loved one can still be outdoors and be as safe as possible under the circumstances. So really identifying safe spaces and places where your loved one can be out, because isolation and being inside all the time is hard for everybody. And if you have an elder who really loves going out, try to divert their where they go, so that you lessen the risk. Going to the store, yep, that's got to be done, and that's something that everybody, typically wants to do. But if there are things that you can do, substitutions, the backyard is always a great place, or a friend's backyard. Identifying spaces that are safe, where there are fewer people, is always your best bet.
Okay. All right. So as we begin to wrap up, again, thank you. And as with most of our Facebook Lives, there's never enough time to get all of the questions answered. And so I just want to, again, thank you for joining us today. Just being with you has been ever so helpful and soul easing. And so, one of the things that for those who are being caretakers, and that individual is in your home, and especially if you have children, remember that this may be your trial run on how you provide information to your family members on what you want, should they have to become your caretaker. So, I look at it now and I think, yeah, this is my trial run. This is my show before the show. So with that, we want to let you all know that this video will be available along with our other information on the center's website at caahealth.org. And that next Friday, we'll be discussing the impact of COVID-19 and race relations on our youth during our Facebook Live Lunch and Learn session. Again, we want to thank you for joining us. We'll see you next week. Look to both of those websites for additional information. Thanks, Nadine.
Thanks so much for having me, Yolanda.
All
Have
right.
a great day, everybody.